Welcome to another broadcast by the UK Medical Freedom Alliance, the UK's most recognised and respected organisation advocating for every individual's right to informed consent, bodily autonomy and medical choice. We are the UK's voice of ethical medicine. Well, hello everybody and welcome back to the UK Medical Freedom Alliance. These are our broadcasts, which we're now calling Medical Ethics Reports. You'll see that we've done a new pilot this year, and we're going to do a lot more of these as we go through the year. And in this particular one, I'm going to call this a special report because we're joined today by a good friend of ours, actually, in terms of the organisation. And I know members of our organisation also feature on groups that he's also belonging to and have tried to support him as much as possible. And this is Dr. David Cartland. David, thank you so much for coming on. I know that you're run ragged with time. And I know you've done also a lot of these, and I'm minded that I don't want to repeat too much that's already out there. But by the same token, the message needs to reach everyone, and I guess as many platforms that you can use is the better, really.
No, thanks for having me, and it's always a pleasure, and a great organisation that you guys are. At the end of the day, the reason for these interviews in the last few weeks, I mean, I'm getting a bit of interview fatigue, to be honest, but it's to get the story out, and the reason why is because this could happen to anybody. This literally could happen to anyone, and we'll discuss how bad it's got, really, as we go through the conversation.
Yeah, we'll obviously focus on what's happening with you, but you're absolutely right. It could happen to anyone, and it is happening to a number of people in many different ways. I mean, not just doctors, but people in other professions as well. And also because if they happen to speak out in their particular area, which goes against a particular narrative, they find themselves in trouble. In trouble with their own organisation, in trouble with the police, the courts, and some have even gone inside. So it's a tricky time for a lot of people. But focusing on you, I mean, we really feel for you. I mean, you've been through the mill and backwards, and as you alluded to just before we started recording, you're feeling like you're not looking your best right now, which, no, you still look great to us, mate. But, you know, I understand where you're coming from. When you do comparisons to what things were like 5-6 years ago and what they're like now, they're chalk and cheese. So maybe a quick potted history then of how did you get to today and feeling the way you do today?
Yeah, it's a big question, really, in a way, because it spans the 5 years. And really, to summarise it, I have views on the pandemic as it happened in real time and based on my own lived clinical experiences. And so, you know, I had these really far right views on ethics. Ironically, we're doing an ethics conversation. It was all, you know, everything I've done has been steeped in the ethics of informed consent. And, you know, I witnessed with my own eyes when these jabs came out that we weren't giving information. So how can you get informed consent without information? And then we had guns to people's heads saying, if you don't do it, you can't go on holiday, you can't work. This is not what we do in medicine. You know, and we've got things, you know, advanced directives, things I always use Jehovah's Witnesses as an example. They've got bans on that says, as per Leviticus, you know, they cannot have a blood transfusion, full stop. And I've seen 2 women die of you know, bleeding out, exsanguination, because I've not been able to give the treatment to save their life, but had to respect their advanced directive, whether I agree or not on that biblical passage. And so that was it, informed consent. I veered into masks and lockdowns, just the pointlessness of them all. You know, lockdowns, we were locked down the day after we were reducing the level of disease from high to low consequence. That just didn't make sense to flatten the curve, a curve that I never saw take off. Again, that was an incidental finding through this, that it was very quiet in the Midlands. It was across different parts of being a doctor. So I was an urgent care doctor, a normal standard GP in primary care day job. I did A&E work as well as a GP in A&E and clinical navigation, and also out of hours. So I had kind of quite a good view of the front door of the NHS system. So it was the consent, it was lockdowns, it was masks. And then finally, it was when the vaccine came out and it was harming people. So the first concern I had was that they were going down the ages very quickly, when I was seeing the only people that really were sick from the disease were the sick, infirm, obese, or had multiple comorbidities. And even then it was questionable, was it COVID or was it something else? Was it just a test telling them they had COVID? And all the silly stuff about what was a COVID death. What is
Yeah.
PCR that sensitive and specific? Calling out these scientific arguments, these silly rules that are coming out, rules of 6, bubbles, you're allowed an hour out of exercise, you could sit and have a plate of food in front of you that would protect you from the COVID, but as soon as you stood up, oh, attack. So there were these kind of scientific discrepancies I had. And then finally, like I say, children and pregnant women were the focus of I stayed in my lanes really. Pregnant women, children, they are the crux of, what you would class as the most protected two groups. And there we are getting the government saying, contrary to what I've read in the Pfizer documents, that kids were never tested upon and pregnant women were never tested upon. You are seeing these bold claims of doctors stating it's 100% safe in pregnancy and children. And then you see the JCBI come out and say, we shouldn't be giving it to this cohort. This is the Joint Committee for Vaccines and Immunisations saying we shouldn't be giving it to children. Then the government come in and overrule it. Just absurd. And I'm sat there as a sort of clinical spectator. And finally, the last straw for me was a vaccine injured coming in to see me and saying, look, I've had that second jab and I don't feel right, doc. And we had everything from deaths from the vaccine all the way from just general non-specific, I don't feel right, I've not been the same, brain fog, neuroinflammatory, heart issues, clot issues. And these are people coming to me saying, look, I'm 23, should I have really have had heart attack? Should I have been having a stroke in my early 30s when I've led a clean life? I just had the jab last week there. Is that anything to do with it, doc? And of course, I'm not going to be the gaslighter that most of the profession have been. I would say, yes, there's a temporal relationship. And we know these vaccines can cause bleeding and clotting issues. So you might be right there. And then I'm hearing that all my colleagues are just flat denying it. So that's how I got into trouble. Spoke about on these 6 or 7 themes. And that led from my career taking a nosedive. I'd gone from an academic career that was unblemished, 2 first-class honours degrees, finishing high up in the rankings of the pass-out exam for a general practitioner. And suddenly I was getting 256 GMC complaints from the moment I spoke out. And the reason I spoke out publicly was I tried everything in my power to do it the right way, contacting partners in the practice, seniors, discussing it with colleagues in the coffee room, trying informal. Are you seeing this, guys? Because that's what I'm seeing. Are we really giving informed consent by just sticking the needle in the arm, pressing the syringe with zero information exchange, let alone, threatening them that they can't travel or work? And you just deaf ears, brick wall. And there's this collective, the real pandemic for me was ostrich syndrome. That people were heads in the sand, flat denial about anything that I was seeing. And they're making you out, and that's gaslighting, making me out to be the unusual one, even accusing me of being an anti-vaxxer very early on. And saying, oh, you're just pinning everything on the vaccine. You've got this bee in your bonnet and you're pinning everything on it when it actually wasn't me. I had the vaccine. I had 2. It's not even a vaccine. So I've become this kind of vaccinated anti-vaxxer, which is quite a USP because I had it myself and it made me ill. And it was making all my patients in quite a small setting in a rural practice in Cornwall, closed community, seeing all these people coming in. And so these 256 complaints came in, and they were basically social media complaints. Dr. Cartland he's put this on Facebook, he's put this on Twitter, and I've read the complaints. I've done an SAR, and they are literally just snitches to the head teacher, as I call them. They're just doctors and anonymous trolls, and there's a lot of those that are obviously tasked with taking down dissenting voices, such as myself. And they've kind of made my life a misery, really, because as we'll come to later on, it's led into all sorts of knock-on effects through my life, instigated by, I've been found guilty of harassment. I haven't got a harassing bone in my body. I've entered some pretty fierce debates with some pretty fierce trolls, and been victim of what I call rage baiting. So the people I was accused of harassing, my victims, were rage baiters in various different ways, whether it was false claims, deliberate false claims, saying things like it's 100% safe in pregnancy, knowing damn well there is no data to support that position. I would call that doctor out. Perhaps not in the best way. I'll put my hand up to that and say, look, I've been volatile. I've shot from the hip. I admit that maybe I should have just ignored them, but I felt the public health aspects of telling pregnant women to large audiences on TV that it was safe in children and pregnant women was a major breach in professional standards. So I would aggressively defend my position, and that was botched together as Dr. Kant's harassing these individuals who are just simply following the NHS protocol. And then the final crime, bearing in mind 256 complaints were whittled down to 5. I was took to tribunal for 5 cases. The other 251 were thrown out. So hence proving the fact that they were vexatious, nothing burgers, for want of a better phrase. The police have received complaints about me in their double figures. They get thrown out. The Football Association, as we'll come to in a bit, have received loads of complaints about me to do with social media. And you've got to remember, exemplary clinical career, no patient involved, no clinical negligence involved, no patient complaint. And yet they're taking me to a tribunal for harassment of 3 doctors, a practice manager who discriminated against me, called me an anti-vaxxer and a rabid anti-vaxxer, and then writing 5 letters. People came to me in my private capacity and said, look, my wife's dying in Canada, or my daughter's had a turn for the worse. She's given birth in New York City. She's dying. The baby's sick in NICU. I need to get there. My GP won't give me a letter. So I wrote these things that I call now to this day letters of support, to say this person's got the right to say no under refusal of consent with capacity. These are ethical principles enshrined in medicine. They've got the second principle being primum non nocere, first do no harm. That's my Hippocratic oath. And finally, bodily autonomy. And I'm being told by the GMC none of these 3 reasons were valid reasons, and I was willing to allow my own ideology to flout international safeguarding regulations during a worldwide killer pandemic. That's how they framed it. They actually found me guilty of falsifying medical notes, which I didn't do. I wrote letters that were never shown. The GMC never had a copy of said letter. When we asked them what international policy did he flout, they were unable to cite an example. We said, you said Dr. Cartland hasn't used the correct eligibility criteria. Then can you tell us what the eligibility criteria were at the time that he wrote them? Well, we don't know. We haven't got a date or a hard copy. But they found me guilty anyway, Ian. That's a fact. I mean, it's like being found guilty of a crime without forensics or ballistics or any evidence.
Yeah, well, that goes totally against my world, because I don't know if you know, but I was a police officer for 10 years back in the day, and then I was a private police officer for another 10 years doing criminal investigations. And so I'm all about evidence, always have been, and that's what I think brought me into this in the first place, was because I was very frustrated with what I was seeing, with what was happening with you, what was happening with Sarah Myhill, Jane Donegan, and McCloskey, and so on and so on, and just go on. There's so many now, and I know you probably felt very lonely at the time, but maybe you don't feel quite so lonely now when there's so many others that are going through not what you're going through, but something aligned to it and similar.
I'd have said safety in numbers, but it's unsafety in numbers. We're all getting the same. But as you know, in a policeman, you know, the yardstick that you have to reach to charge somebody is beyond all reasonable doubt.
Absolutely.
Those 2 things I've been found guilty of is in an employment tribunal setting. They're just an employment tribunal. Yeah, there may be a medical regulator. They're supposed to be a neutral regulator, yet they invest in big pharma, including one of the brands of the vaccine, AstraZeneca. And they're ruling on it as if it's a court of law. And what I didn't mention before is the first thing they did was eliminate the prosecution. Were telling the legally qualified chair, MPTS, and my defence barrister that we couldn't use various parts of my defence bundle. Now, correct me if I'm wrong, a judge sits and presides over both sides of an argument, and then the judge and jury decide, whereas the GMC, as a regulator, an employment tribunal, said Cartland's not allowed to use any of his 6 witnesses. Has anyone ever heard of that before? All witnesses told that they had inadmissible and irrelevant statements. And I'm here to tell you that those 6 statements, it would have been a game changer if they were read out. Believe me, it was the 3 people that were my victim that were doing it.
It's not for them to do that at all. No. I mean, in a criminal matter, both sides, it's incumbent upon both sides to not only declare all their evidence, but to scrutinise it and to make sure that and nothing is rejected until it gets to court. Then they might reject something in court, but it's not down for either side to do that.
Well, the case with the practice manager, Ian, was, like I say, I just published the email where she called me an anti-vaxxer and this and the other, and she just won an award for being non-discriminatory under some DEI awards. So I posted the email. I said, if you can't get an appointment at this surgery, it's because they throw CVs from people who've got first-class honours degrees and are dual-trained. And that was it. And essentially, she said that she received hate mail consequent to my post. And the hate mail was from the World Council for Health, Mike Yeadon, and a retired accountant locally who wrote to her, furnishing her with the Pfizer documentation. GMC threw this all out. They threw the whole case out 4 times over. She's even emailing them on Christmas Day. This is how fixated this person got in the end. And, you know, she was told that Cartland hasn't released any personal information that isn't in the public domain already. The next minute, she's being met with a chap in the car park with an envelope. With the Getter post from yesteryear, where allegedly I posted personal details about it, which I just wouldn't do. GDPR as it is nowadays, you have to be ultra careful. I wouldn't go on bloody Getter and post somebody's personal details. This was documented in a 25-page witness rebuttal that I sat up all night to correct and write and review, and it was checked by other people. It was submitted to my barrister, to the GMC's lawyer, and to the investigation coordinator, James, and I've got read receipts for all three. If you look at the MPTS determination, it says Dr. Cartland did not bother to furnish a defence bundle for this case. You can read it for yourself. What's happened there? What's my barrister doing? And what are these two people who've received it doing, allowing that to be read out? And it just went on like that. It was a complete kangaroo court in the most ultimate sense. But as we're going to talk about, it's had further repercussions on not just taking my medical career away.
Please sign up to receive our newsletter and you'll be notified of UK MFA campaigns, open letters, calls to action and any important updates. You can do this on our website at ukmedfreedom.org. That's ukmedfreedom.org.
Well, let's just go back to the beginning a little bit, because I'm interested to know when you started to pick out things that you felt were wrong, the alarm signal started. Why do you think it was you that were picking these up and your fellow doctors weren't? Or was it a case they were picking them up, but they decided to do the hear no evil, see no evil thing and just keep quiet?
I think the latter's correct, really. It's a bit of both, really, politicians' answer. But the fact of the matter is, I mean, I couldn't be the only one in a room. You see 30 people a day in a small surgery. You got 2 or 3 doctors working in synchrony day in, day out. They must be seeing these things. There must be, and for me, there was a big uptick. So after the first jab, there was not a lot, really. I wasn't really that concerned. The second jab, started to see a few people come in, just 1 or 2. It sort of pricked my ears. And then the third one, it was when the booster came in, it was exponential. Everything shot up, including deaths. So I always talk about this Eureka week where 2 women died in their 40s from the AstraZeneca jab. That wasn't up for discussion. That was a coroner stamped VIT by AstraZeneca. And then the final one was a man who had a cerebral venous thrombosis the day after his Zeneca. And I'm trying to beg my boss at the time to stop giving Zeneca, 2 deaths and a serious brain clot. Like you would normally just stop at that point and investigate. And he said, the show must go on. What do you want me to do about it? And then they vaccinated loads of Penzance members of the public unwittingly that very weekend with probably about 500 Zeneca jabs. If somebody can make me understand how somebody can be told about the death of 2 40-year-olds and then go on and use the same drug on the public, then, and I'm the crazy one here.
Well, I think that's reckless behaviour. So, I mean, based upon what was going on there, I mean, there were people that I was working with at the time, albeit in a clandestine manner, who was putting together police reports and submitting them, and they were being turned away. But we were basing those police reports on the fact that these injections were being given in a reckless manner. So therefore, there was almost a possibility of manslaughter and grievous bodily harm as a result, because the informed consent certainly wasn't there, because no one could give informed consent because no one knew what was in there. You couldn't explain to the person receiving that injection what the contents were. And because
I know doctors now, Ian, that don't know. When you say to them it's actually wrong, the wrong nomenclature, because calling it a vaccine's wrong even by its technology.
Oh, yeah.
It shouldn't have even been regulated by the group that regulated it, because it fell into biologics and gene therapy, and that takes 10 years to bring to market.
Well,
so
exactly.
They couldn't allow that little truth.
No, by calling it a vaccine, they were then able to use this wrinkle that they could give an immunity to the producers of the vaccines.
Yeah.
Or gene therapies.
I mean, their other trick was, obviously, at the time, you weren't allowed to talk about the anathema that was treating people with COVID. So whether it's COVID, whether it's something else, that's a debate for another day. But there were people with some moderate to severe respiratory illness at the time, which you expect at that time of year anyway. And I was just giving them steroids, vitamin C and D, and budesonide inhalers or something similar, beclomethasone, and they were getting better. I myself had some sort of wheezy respiratory thing before the pandemic was officially announced, and the thing that got me better was the steroid prednisolone, because it kind of stopped all of the inflammation in your chest. So I'm not here to deny COVID per se. I'm just here to say it was very quiet. The people who did get ill were already ill people, and the way they quantified the metrics of death within 28 days of a positive test means absolutely nothing to anyone. Yet you saw this ticker tape going across, unapologetically stating that was the metric being used. It's just absolutely insane. What does that even mean? You could have your test today and get run over by a tractor down the road in Cornwall here, and you'd be put on the list. Absolutely insane. And we were seeing real cases of people who drowned and they had COVID tests the week before going on the list. How on earth is that a measure for a pandemic?
And I don't believe the hospitals were as banged out with patients as they were saying. And that was based upon the fact that I had to go to hospital during this pandemic for a regular thing that I got. And I was in a lift with a couple of porters in the hospital, and I don't think they realised I could hear what they were saying. But one guy said to the other, "Well, how are things in the COVID ward?" And he said, "Oh, it's fine." He said, "There's hardly anyone in there." And he said, "Oh, I thought it was supposed to be full up." He said, "No, no, no." He said, "It's half full, and that's half full on another half full basis, and that the fact they spread the beds out so they weren't supposedly on top of each other." He said, "So no," he said, "we've hardly got anyone in here." He said, "But we're not allowed to let anyone through the door, so no one knows what's going on in there."
Yeah, the thing is,
And that's a conversation
they were taking swabs of people, so you could walk in with an ingrowing toenail infection into minor injuries. You'd get a swab, and if it was positive, suddenly they're swarming around you, saying, you've got to have all this PPE on. I've been to COVID wards myself. They were very empty. The nurses outweighed the patients in terms of number. And there were people in traction from fractured neck and femur fractures, and I'm looking, I'm saying, well, he doesn't look like he's got COVID. Oh, no, he's a neck and femur, stepped down from TNO, but he tested positive. So he's got no respiratory symptoms, nothing. But you're treating him like he's got some killer disease of the respiratory tract. Yet he's not even coughed. And this is what I was seeing. And then the A&Es were quiet, the ITUs were quiet. And then you come home to the BBC and they're giving you these horror stories of the zombie apocalypse. And literally, I was in those hospitals and it was dead. I was even going around donating food and pizzas to the heroes with a politician that wanted some support on their campaign. And I was seeing deep into hospitals. I was going in with stacks of pizzas, and I was seeing the ITUs and I was seeing the COVID wards empty. So it never really happened for me. And then this chap came to solve a problem that never stood anyway. Like I say, flatten the curve. There wasn't a curve at all. Save the NHS. Save them from what? TikTok choreography. And I saw that with my own eyes as well. I was in surgeries where we had nothing to do. And you've got the girls, the healthcare assistants and the nurses with hula hoops downstairs and doing the YMCA in various incarnations. I'm like, what is going on here?
Well, apparently in the Nightingale hospitals, they I think in my local one, they were doing aerobics classes for all the nurses and doctors that were there.
Yeah.
They were doing that all day because no one ever went there. They never once spilled over into a Nightingale.
Yeah, and think of that from a public health perspective. You're allowing the public to believe that the doctors are overrun while they're dancing and prancing around. And meanwhile, people have got, their rectal bleeding that they've had for 6 weeks. They're just holding on to it, saying, don't want to bother, the doctors are that busy. So you've created that public health issue as well about people withholding their own search for care. And so that caused delayed diagnosis as well. Another part of the increased morbidity and mortality associated.
Not to mention their mental health as well, which was going south as well because they're locked indoors, can't see their relatives, friends. Yeah, it's just
many people killed themselves because of it. They couldn't cope with it. I saw the aftermath. The back end of my career before I was called a danger to society as a doctor. I was seeing these adolescents that lived through this scare tactics, this fear porn, and you were seeing like the lockdowns and the masks and the TV reports put the fear of God into our children. And that was one of my concerns about the lockdown. Apart from its futility and its financial knock-on effect, it was the kids. Kids need to see each other's faces. What's this going to do to speech and language? What's this going to do with people? Kids read each other's expressions, and you've got this thing that doesn't work sat in front of their face, stifling basic communication. Even patients, when you're examining as a doctor, you feel someone's abdomen, you're looking at their face, and they've got this big pointless blue thing on them that doesn't work.
Yeah.
And I'm the insane one here. And I've been told I'm mad for having these views that the masks don't work, the lockdowns are dangerous. And
I was told the same. I mean, a lot of my friends, because I when I left the law, I went into IT, which was purely an accident, but it's because I learned so much about it when I was doing the law stuff. And but I was working with some very, very intelligent people, and supposedly, sort of science degrees and IT degrees, and they knew the ins and outs of a server room, and they're supposed to be very, very clever, and yet they were all masked up when we went out socially, and I'm looking at them, and I said, "What are you doing? Have you actually thought this through?" Well, no, there's a pandemic. I said, but I said, you run projects. I said, and part of a project is doing your due diligence. So you look into everything before the project starts. You look at all the risks and benefits of what you're going to be doing. So I said, have you done any risk-benefit analysis of what you're actually doing regarding wearing a mask? No. I just found it astounding,
Well, it reminds me of a story. I was working at an urgent care centre, and they basically brought out the mandate again. It was coming in and out over the years. And this particular day, I was doing a shift on this hot day, and I saw my first patient. The department was heaving. Got a tap on the shoulder. Mask mandate. You need to wear a mask in the urgent care centre and in radiology, but nowhere else. So get this. So I mean, certain parts of the building you get killed from COVID, but other parts you say. So anyway, we had big debate. She called me pedantic, and I showed her evidence on my phone saying the masks don't work and they make you hypoxic and they give me a headache. Personally, I've got asthma. I got marched out of that building that day and suspended, only to work the next day. I was only suspended from that role because the mandate was only for that building. The building down the road for the homeless centre, I was allowed to work at, and I was doing a ward round on the day. And this was the moment for me that just showed the insanity. 5 people, senior to me. We did a Zoom call. So I was the person in clinic in person, and these people were working from home. We did a ward round that was virtual. And as the screens pop up for Zoom, I was greeted by these 5 faces in their home offices with masks on. Alone. These were senior doctors and consultants and GPs. And I said something, I told them about what happened the day before. And I said, look, consult your grey matter. That's the exact phrase I used. What are you doing?
Yeah.
You're at home. Who's going to get you? What are you scared of? And I get a phone call from the medical director of the county saying the doctors have been a bit concerned about you. They said you went on a bit of a rant on the ward round, and we're just a bit concerned about your mental health at the moment.
Really? Your mental health.
These are the guys who are sitting on their own with masks on, and they're telling me that we've had concerns expressed that you're a bit fixated on the mask issue. Bearing in mind, I'd only just been marched out the day before. So,
yeah, like the people driving their own cars were driving around on their own in the car wearing a mask.
In Cornwall, they're on the beach with them. They were at the peak of insanity. They were swimming because you got Hillary Jones on the TV saying, "Put them on when you're swimming." Yeah. You got people with tan lines, and you've got the mask white patches from where they've had the mask on. Sunbathing. I mean, help me understand how we're the mad ones here.
I'll never understand it, but I know you're not mad, because otherwise I am too, and umpteen others are. We're not definitely not mad. And if anyone thinks a virus is that clever and that intelligent that it will only stay in certain places and attack you when you're walking across a restaurant floor rather than sitting at the table, and that, all that sort of stuff. And
there was that thing, wasn't there, Ian, with Scotch eggs? So you could go out to the pub, but you had to have a substantial meal. So people were saying, "I'll have a pint of lager and a Scotch egg," and then there was a big hoo-ha saying, "No, it's not a substantial meal." So people were asking for a Scotch egg with a salad and dressing. So the salad protected you
for the benefit of my health.
Yeah. We laugh at it now, but people literally went into psychosis. Still are, some of them.
Oh, you have to honestly, you have to laugh, and because if you don't, you're going to be crying for the rest of your life, and we need to keep our spirits up, I think. And I mean, I think, thank God for us all that we can talk to each other, and maybe we can have a giggle about it occasionally, because it is insane. It doesn't make sense. The powers that be, as we call them, none of them make sense. In fact, every day they all become more nonsensical with their reactions. I mean, as you know, Sarah Myhill had the same experience with her GMC hearings. Again, witness statements pulled away, not being able to give certain information, no complaints from any patient whatsoever. It was, again, all from these dark shadows in the corner that were probably what I call spiteful animals that have been driven into a corner. So now they're being spiteful and and just finding someone to pick on. And you are one that's been picked on, I think. And they've decided they're going to make you the scapegoat. They're going to make you the example, to try and make sure that no one else ever tries to stand up to them. But more and more people need to. They need to stand up, be strong, like you, like Sarah, like Jane Donegan, like Aaron Witowski, and say, no, we're not putting up with this.
Yeah, it's not bad company to be kept, the same sentence as those guys. Those guys are my heroes, and you got to remember, all of our lives have been. It's not just the outcomes of these tribunals; it's the attrition it has on your mental health. It literally, the stress, the financial drain, the reputational damage. I mean, if you Google me, and I invite anyone who watches this to Google me, and you'll see what people, the person just coming across David Cartland who doesn't know any different will read about this bully, this harasser. this evil man, this dishonest character who was falsifying medical notes. There's even hit pieces been written about my views on the trans agenda that have been spun into I'm homophobic, when I've actually just had safeguarding concerns about trans women dancing and prancing around kids with sexually explicit wear or equipment around them, shaking hands and picking up kids. And I was found guilty of showing hostility to the LGBTQ plus community, which allowed the local paper to then write a hit piece saying, inside the warped mind of dodgy struck off Cornish GP and his homophobia. Again, I invite any of you to read that with the neutral mind and see if you think David Cotton's homophobic, because newsflash, I'm not. I've got a problem with the trans agenda, as many people in the LGBT community have also.
The best place to find our content is on our Substack. That's at substack.com/@UKMFA1. That's substack.com/@UKMFA1. You'll also find us on Rumble, YouTube and Odyssey in video format, and also on your favourite podcast in audio format. We tend to use Apple and Spotify, but of course you'll find us in lots of other places too. We publish everywhere. You'll also find us on the mainstream media and alternative media too. So look out for us on your favourite channels. And don't forget, like and follow at every opportunity. Thank you.
I truly believe there's something seriously wrong there, because we took criminal cases to the judiciary that were very, very carefully put together, evidence-based, creating certainly reasonable suspicion that there was something criminal being undertaken. But they totally refused to look at it. And now we've found out that there's been a complete circular sent around the senior officers in the police forces around the country to reject any applications for crime reports involving anything to do with these jabs.
Operation Teller.
Well, yeah.
So there we are. I mean, this is it. I mean, and if that can go across the hierarchy of police, then the same can go across the judiciary. And when we've got people who are being arrested and put in Nick for 2 years for thought crimes or for tweets, thoughts put into writing, without action, then you've got the same judge who was suspending sentences on paedophiles. How does that correlate on the same day sometimes? I'm sick of reading about suspended sentences for perverts who have a sexual interest in kids. It's insane.
But I think that just tells us a story that actually says exactly what is happening. That describes the world right now and what is actually.
We've also got it in the regulators, Ian, because I'm sat watching as a struck off doctor, and even the BBC are covering this. You've got doctors who are raping patients, and because it was a one-off rape, they're letting them off. Read this for yourself. They're castrating women, doing inappropriate gynecological procedures, removing ovaries. No action taken on this doctor in Blackpool. You've got doctors that are having sex during operations where they're the anaesthetist, nipping out and having intercourse with the nurse and popping back in while the patient's under their care, and let off, no suspensions. And I'm looking at that saying this is clinical negligence, criminal negligence in some cases. This is like perversion in some cases. I mean, we've got sex offenders on the list working as doctors as we speak, in the double figures. And what did Dave Cartland do? He wrote some letters and called out some doctors, and retaliated to a massive campaign of rage baiting from a very organised group. Anyone who knows me from Twitter knows I'm constantly calling out this group. And again, the irony was I was found guilty of harassing probably one of the biggest known harassers and bullies on the internet. And anyone who's not been on Twitter, it doesn't mean a lot to, and I won't name names, everyone knows who this person is. And I was found guilty of harassment of this individual. It's actually a sick inverted joke. And we've to the point now where it wasn't just the strike off. So I've lost my career that I was 17 years into, 20 years left to give. Then they go for the media campaign. I mean, the Cornwall Live, the local paper, wrote about me 12 times in 2.5 weeks. I mean, I don't think Brad Pitt gets that sort of attention, does he? Or Hollywood stars. 12 times I was the double page spread in the local rag, the Cornishman, same page, I reached PLC, completely slandering me on a local level. Then the BBC and the Daily Mail and the Sun and the Mirror, pictures of me calling me an internet pest. And I'm like, how is this actually happening? Like, I've literally stood my ground on a position that children and women, pregnant women, shouldn't have the jab, and suddenly I'm the internet pest with a picture of me with my cup of tea. And I'm like, well, how? But it's as we'll go on to in the discussion, this has now led to real life consequences. Should we do that bit now about DBS?
Yeah, let's go on to this DBS situation. But I mean, but just quickly, I think it says to me that that's because you're over the target. Those that are getting close to showing all this up and what's going on, they're the ones that are being pursued and being gone after. And I think that's why you're a victim of this.
Yeah.
You know too much. You're too clever, and they don't like it. And so they're being very, very spiteful and nasty. And I think this also then brings us nicely into actually the DBS situation, which is the old CRB checks, Criminal Record Bureau. What actually happened there? Because I can't. Who referred you in any event to that?
I'll tell you the tale of woe quickly. So first to say, I'm not clever. I've just got common sense. I don't see this as me being in an academic superiority to any other colleague. I was just like, and I had the jab myself. I was that, trusting that I stupidly bent over to the, put my arm out and said, look, give it to me for the mandate. So, I'm not completely squeaky clean in that I'm a vaccinated anti-vaxxer. Stupidly took those 2 jabs, but we'll park that. DBS. So DBS, as you mentioned, it's the rebirth of the CRB check. So if you go for a job application, you need to know if you've got a convicted murderer coming to work for you or something similar. So you run the name through the CRB check, it flags up Dave Cartland did this in his youth or whatever. It's now been reformed to DBS, Disclosure Barring Service, opened it out. I think it was Ian Huntley, the case of Huntley, because he wasn't convicted but managed to get a job while he was being investigated and killed people whilst working as a school caretaker. If I don't know the case that well, but an evil man. But it was opened up for that reason, as a crime had not been convicted. So to be on that list, you have to be a criminal, convicted, tried in a court of law, found guilty beyond all reasonable doubt. And then second reason, if you scratch the surface, you can be put on that list for not committing a crime, and you have to have passed what's called the harm test. You have to have demonstrably harmed a vulnerable adult or a child. Now, bearing in mind, none of the GMC case even mentions the word vulnerable adult or child or children. It's a spurious referral, but you ask, how did it happen? Apparently because all misconduct charges from regulators have to be put through the DBS to assess as to whether I should be put on the list.
It's not just a police referral then, because when I
No,
thought
it was nothing to do with. No, I've never been in front of a copper. I've never been arrested. I've been interviewed recently for one of my harassers trying it on, saying I was harassing him, and they NFA'd it within less than 24 hours because he'd been firing death threats to me. It's the most ridiculous. I don't know what the guy was thinking to get me into the station because it completely exposed him. But going back to the DBS, if you're on that list, it means that you are not allowed to work with, in an unsupervised capacity, children and vulnerable adults. Bearing in mind, you have to pass those tests, convicted criminal or harm to either of the groups. We wrote a brilliant rebuttal. This came on Halloween. Funnily enough, the letter came. This was months after the strike-off, saying GMC have passed this on. We're going to assess it. You've got 8 weeks to write the submission. I got a barrister to write a brilliant letter saying this is abuse process. He's been done by a regulator. It's not been tried as a crime. He's not been found guilty. There's no crime number or conviction. No children, no vulnerable adults, no harm, no abuse. It was watertight. And then I got 10 people to write me some references, from ex-MP Andrew Bridger all the way down to Ros Jones. She was brilliant, wrote a brilliant letter from a safeguarding children's perspective as an ex-consultant paediatrician, and others and other people. And it was robust. And they came back about 2.5 weeks ago and said, we've decided to put you on the list. And I mean, to say, I nearly fell off my chair when I read it. I was shaking for about 3 hours afterwards because I couldn't understand how I've surpassed. Somebody signed this decision, and this is going to have repercussions, and we'll come to what some of those have been since. But they put me on a list amongst criminals and perverts and people who have harmed children and vulnerable adults. And they say this is an indefinite ban. You've got a right to appeal in 10 years, in 2036. You've got a 3-month window. You've got to go to the High Court, the upper tribunal and the High Court. I've got to firstly now apply for permission to appeal the decision. So that's where we're at the moment. And the reason they give, and specifically I'll just use this as an example, the reason they justified the fact that I was put on the children's list, bear in mind the first 6 pages of the 10-page document was basically the GMC's employment tribunal findings. They can't question that. They're there as statements of fact, whether they're true or not. Believe me, then there's another side to those stories. But I'll try and remember the sentence as best as I can. As I mentioned, I admitted to doing 5 letters of support, which they rebranded as falsifying medical notes. So they said, Dr. Cartland, you were willing to flout international safeguarding regulations and policy during a worldwide pandemic, allowing your own ideas and opinions to compromise such policy. So, if you were to work with children in the future, you may allow your ideas and opinions to overall child safeguarding policy, just as you have in this case with the vaccine exemptions. So, if you were to work with children in regulated activity and that were to happen, then you'd be a danger to children. So, we're going to put you on the pedo list. I mean,
How on earth did they make a letter in support of someone travelling into an official doctor's
Andy,
note?
and they never had a copy of the letter to even say the date that they were written. They don't even know what countries. I know that they were never checked. None of the 5 letters were ever checked at Border Patrol. They were insurance policies in people's handbags in case they
Oh,
met a job's worth, in
yeah.
immigration or on the airline or on Border Force. None of them were checked. Now, if it was a frivolous reason, the Border Patrol can say, well, that isn't a valid reason on your bike. But they
Right.
were never checked because the rules at the time were like non-existent. They were done as, but still, the truth didn't seem to matter to the GMC when we actually said to them. But the consequence of them finding me guilty of this falsifying medical notes malarkey has put me on the children's barred list when there was no children involved
Yeah.
and no crime. Falsifying medical records is imprisonable sentence. They're made
Mm.
out like I've sort of broke into a surgery and hacked the system and changed someone's medical notes. Sinister. And actually, it was a free service in support of 5 people in extreme circumstances, backing them for their human rights, twisted into my safeguarding concerns. I've become a safeguarding concern when there were no children. So, I mean, you put this in front of a policeman, and as an ex-policeman, this would be thrown out. The
Well,
whole
absolutely.
harassment case would
Because
be thrown out.
also it begs the question: well, why didn't they report you to the police then?
Yes, because they know
had,
it's frivolous. They
yeah,
know it wouldn't. They know the harassment charges that they brought in an employment tribunal. They ran it like it was a court. I mean, they didn't
right.
just bring in anyone. They brought in the head of the CPS London, and they brought in a homicide and terrorist barrister for the legal counsel for the GMC. These guys were on £6 a day, from what my
Mm,
research showed me. These weren't cheap. They brought in
mm.
the creme de la creme, and I sat and watched and listened to them making these ridiculous rules and decisions. And you can't have witnesses. And this barrister for the GMC, Moran, who's now been promoted after my strike off, has just completely sat there and, as far as I'm concerned, lied, misdirected, misrepresented, completely removed context from what he was saying, and made me out to be Satan incarnate for the 2 hours he had free reign on the microphone, where he opened his case against me and basically said, Dave's a bully, he's harassed this guy and that guy, and he's done this, and didn't mention why I said what I said. The context is always key. You can't look at a screenshot of something. I might have said the most abhorrent thing to somebody, but if somebody above me has said something very abusive or personal, then there's an understandable nature to that retaliation. And that's all it was. They took my retaliation to several. I've probably got about 50 people that do this day in day out, abusing me. There's pictures of me in bed with Jimmy Savile. People accuse me of being on the Epstein list. There's people have put some really disgusting religious memes about me. I won't go into the details of that, but just disgusting stuff that you would normally get arrested for. But the police don't seem to want to do anything in my case. They're just NFAing everything, including real life stalking and real life death threats. I'm being followed to refereeing engagements, for example, being watched covertly. It's causing me to be a nervous wreck. But should we do the FA now? Should we move on to the FA? So obviously they made this decision, completely wrong. And again, right to appeal. It's going to be cost. It's going to be stress. It's going to go to London, the upper tribunal, High Court. I was very open with the FA. One of my saving graces in the last few months is I've learned, having retired from football, which was hard enough. I used to play from the age of 9 years of age all the way through to my 40s. Never missed a game apart from if my legs gave up in the end. I thought, let's do a bit of refereeing. So I got in as a referee, did the course, achieved promotion in quick time. I've had exemplary feedback as a ref, both at adult level and youth level. I've done 61 games this season. The GMC are fully aware. The FA are fully aware of the GMC ruling against me. I've not hidden it; it's public. You can see. That said, they're aware of it and have allowed me to officiate games of every level, from veterans down to under nines. The FA were made aware that I could be put on this list, but none of us really thought that this was going to be acted upon until the day it was acted upon a few weeks ago. So I rang up the league and said, look, I've been put on the list. I can't believe it. And they said, right, okay, this isn't county FA stuff. This is going to be Wembley FA. Now, bearing in mind, no one from Wembley FA has called me to get some context to this or had a conversation. I received a warning from Cornwall FA that I am not allowed to take. I was interim suspended from any football related activity. Now, to get such a sanction, being banned from all football related activity, and I'll tell you what that is in a minute, you've got to have really done something bad. You've got to have murdered somebody or bit a referee's ear off or something like that to get such a. But anyway, I've got the suspension, and I asked the FA, what can I do and what can't I do? So they gave me a provisional 2-page PDF of everything I couldn't do, which was everything from administrating, refereeing, volunteering, playing football, which doesn't need a DBS to play. You can be an ex-murderer and turn up and play Saturday League football for the Dog and Pheasant, as I keep saying. Even to referee adults football, you don't need a DBS check. The decision at FA, you go into the refs course and they say, do you want to do youth football? Yes. Complete the DBS paperwork. If you don't, move on. You just go sit down, have a cup of coffee, and we'll get to you in the end. So you don't need DBS to do open age vets, super vets, or women's football. But they banned me from it. In fact, I got 2 things I was allowed to do. So in the what you can't do was about page and a half. What you can do, they said I was allowed to take my child to and from a football fixture. Secondly, I'm allowed to passively spectate football matches in an allotted spectator area, which means when I clarified what can I do, what's passive spectating mean, and they said you can sit, say nothing, no coaching, no talking, no directing, and with your arms folded, and you can soak up the atmosphere of the game. And I'm like, but this got even worse yesterday. I got the official letter. It came through in the afternoon. They've told me I'm not even allowed. We have a rota in our village where we all take each other's children to the football training and the football matches. It works really well because it's 5 kids. And I've been doing that for weeks and months now. The parents trust me. The FA has told me I'm not allowed to take other people's children to the football, as well as not being able to play. As I said, this is so much overreach. It's edging towards.
Do they actually have the power to do that? What does that mean?
Please consider donating to the UKMFA. We are really grateful for all donations, no matter how small. Your donations enable us to continue to lobby for your right to informed consent and medical freedom to be upheld, and to provide resources to educate and empower the public. There are multiple options for donating. One is that you can scan the QR code that's on this video right now, or you can go to the link that is featured in the description below this video, or you can go onto our website and contribute via donor box, or you can buy us a coffee.
Well, you try and get answers out of them, Ian. I'm trying to ring the FA. They're a faceless, phone numberless organisation. The letter was signed FA. Nothing else, no signature, no name. All the DBS letters have been signed by faceless people. They haven't signed anything, they haven't put a name to it. Operations director is the best I can get. You ring the DBS, they pass you around in a circle until the point you just give up. So these people are making these decisions. Like you say, whose jurisdiction is it over? Tonight we've got a football match, and I'm due to take the kids around the village in to watch it. And I'm being told now if I did that, I'll be sanctioned. I'll be breaching the rules of my DBS barred list. And the FA will further sanction me. It's a parent's decision if they want to trust me based upon what they know of me as a good person and a good neighbour. I can't get my head around this.
No, I can't. Because if the DBS is in relation to
adults,
well, I don't know. It doesn't seem to make sense. The DBS isn't stopping you interacting with children, is it?
And as I said at the beginning, it's only for unsupervised contact with children.
Right.
So, if I'm doing an under-14s game, you've got a sideline full of parents, so hence not unsupervised. And also you've got DBS trained coaches and managers. So where's the issue of me refereeing with a whistle? And the fact that I had to call my team, I've started for a new team. I've come out of retirement, lost a bit of weight, felt good. Thought I play for the local leisure league, really. It's like a jumpers for goalposts kind of league. And they said, you're not allowed to play. I said to them, how can you stop me from playing football? It's not a DBS. You're stopping me from regular. And it's like talking to a brick wall, Ian. It's like talking to a brick wall. You can't get anything. I told the FA I was really stressed and depressed, and it's really affecting me. All the stalking at football matches, I'm asking the FA, please stop posting where I'm refereeing on the FA website, because people are literally posting it saying Cartland's going to be here at 2:00, turn up. And I've had people physically turn up. I've seen them. I froze midway through the match as I've looked across and seen somebody who looks like one of my stalkers. And I've just been dumped after 61 matches. I've done favours last minute, and you're trying to get questions from them. And they've even said in the letter, and I can't remember the exact phrases, so I've got to be careful, I'm not allowed to communicate with anyone with anything to do with any football related activity, including social media contact, text messages, phone calls. So does that mean I can't pick up the phone to my mate who's a ref and have a rant about this? This is complete overreach, and I don't know who's signing these off, because someone at the FA has read something or made a decision that it's a wholly a wholly proportionate sanction to stop me from doing all football related activity, as
But
well as.
not all football comes under the FA, does it?
No, no. This was a real example. There was 22 blokes wanted to play football of their own free will at the weekend. I mentioned to the guy who does the fixtures, "Can I referee?" It literally was jumpers for goalposts. 22 guys on a Sunday morning. They've asked me to referee it. That's how bad a referee I keep getting asked to be refereeing. Everyone keeps asking me from youth all the way up. So I said, "I'll do it," and they said, "No, you can't. You can't." Who are they to say I can't referee?
Well,
22.
yeah, there's no authority there at all, is there?
But the problem is if I went and refereed that game, I'm just waiting for there'll be hell to pay. You try and make it make sense to me. I'm trying to get answers, but again, do you know part of the process is the punishment thing, isn't it? And
Exactly, yes.
the legal recompense here to get this overturned, it's going to cost thousands of quid. Knowing I've got 4 kids, 5 dogs, a wife, an expensive mortgage, and the prospects of getting a job in medicine probably lower than Harold Shipman at this time.
Yeah, yeah. It's
You know,
it's crazy. But it brings me back again to what I said earlier. Is they're attacking you based upon, well, what harms can we cause him the most? Oh, financial, family, social. Just take it all away, and then that's it.
Well, the rumour mill is now, because I've been put on the child's list, is that it will automatically trigger a social work letter now from Children's Services. And I'd love to hear that conversation when they knock my door and say, "Look, we've come to discuss your parenting." And I'll say, "Well, based upon what concern?" "Oh, you wrote some letters to exempt people in 2023 and 24 to go into countries to go and see dying relatives." I just don't know how they're going to botch that into a Cartland's breach safeguarding concern specific to children. You've got to do some serious stuff to get banned from football. You've got to do some serious stuff to be on the DBS barred list.
I'll tell you from actual experience, Bill, although going back to the 80s when I was a policeman, I can tell you have to do an awful lot to have your kids taken away. Well, you did then. I mean, the arguments I'd have with social workers not to return children into places of danger, and yet they would insist that the children go back to mother and father that were on heroin and cocaine and with no food in the house and kids sleeping in wet beds, and you think, well, the kids need to be in a place of safety, and they would insist they go back.
Make sense. I mean, now you've got, like I say, the judiciary are making strange decisions, the GMC are making strange decisions, the police are making strange decisions. But if you write a tweet that isn't quite right, then there they are at your door. It's funny because a lot of my stalkers online are anonymous, and I'm desperately asking the police to please identify some of them. You don't know how incredibly insane I sound when I walk into the police station and say I'm being stalked by the Cornish pasty and Moby Dick. I'm surprised they haven't 136 me there and then on the spot. But I'm saying I need to know the identities of these characters because they've got 3 accounts posting about me 50 to 60 times a day. That's fixated stalking, whether it's cyber or in real life. You've got another one who's literally saying he's going to set fire to me and pour petrol on me at the next time he sees me at a football match, a local groundsman, I'm led to believe. This isn't right, and I just don't know. I mean, they've NFA'd 15 of my 20 cases. They certainly haven't done anything about 5 stalkers that they are investigating. It's gone to cross constabularies now around the country where those 2 of them are identified. There's no action. I'm asking for an update from Gloucester, for example, saying what's going on with this case. Nothing. And then you just start wondering who's crooked in all of this. When you think about Operation Tala, and you had a directive to not investigate anything COVID related, and that's come from the very top, filtering down. I have some really good conversations with the constables, but I'm saying respectfully, this needs to be investigated now higher up, because what they're doing is they're looking at individual stalkers and not stepping back and saying this is an organised, dare I say it, because you can't even say the word gang stalking now, because if you say gang stalking, it's a mental health condition of the person who thinks he's being gang stalked, when actually it's just a description of a gang of people stalking me, which is perfectly reasonable given the evidence I've got. But no action being taken. This should be a Netflix drama, let alone a police investigation.
And yet, supposedly, anyone that's caused distress by anything, I mean, I could say something now that apparently causes someone else stress.
Well, I know that if I went online tonight and I set up an account as Dr. Spock with a picture of Dr. Spock, and I said something quite frankly unwoke, I know by the evening they'll have my ID and have me cuffed. When it's convenient, they will, but I keep hitting these brick walls because there's a level of organisation with these trolls that I still can't get to the bottom of. I've got cleverer people than me who work in cybersecurity. They can't work out who they are. They seem to have all the cybersecurity to scramble their VPNs, their IP addresses, so they can just carry on. And because they're not being stopped by the cops, they're getting more cocky and confident. And these are the same trolls. People say, don't feed the trolls, ignore them, leave them be. We did that for 2 weeks. I protected my account, and that's when we had phone calls from the FA saying we had numerous reports about you, calls from the police saying we've had numerous reports about you, calls from child services, we've had various anonymous reports, calls to surgeries that I worked at, we've had anonymous calls. So they go and I'm saying to the cops, look, can't you? I'm actually trying to forge a conversation between the FA and the police to talk to each other and say, look, you've had 80 NFA'd FA reports. You've had 80 NFA'd police reports. Talk to each other. You can't go into the cop shop and say, I'm the Cornish pasty. I'd like to report David Cartland. You've got to give some personal details. I presume you can't make a police report as the Cornish pasty, but this is what I'm saying. You need to, and why should I, in the middle of this, be organising this, meeting between the two when this is unprecedented? It sounds a bit victim-like, but it is. I'm at the centre of this, and they're ruining every aspect of my life. And somebody somewhere needs to help. I contact the MP, nothing. I contact local councillors, nothing. People that have got connections in the community, nothing. And everyone's like, "Oh yeah, this sounds really bad. This is overreach. This is against your human rights." And when it comes down to actually doing something practically, like getting legal, getting some legal representation, no one wants to touch it. And I find that really surprising because this is an opportunity to correct some pretty nasty miscarriages of justice, yet no one's stepping forward.
They don't seem to have the will, and I think it's just I mean, it's the same problem, probably even at a lower level when you talk about your colleagues, is that they fear for their own livelihoods, and I think that's the problem. One of the conversations I had a couple of years ago was with a former commander of the Metropolitan Police, and I asked him outright. I said, "What goes on at your level? Seriously, what kind of conversations do you have?" And he said, "Well, we don't." I said, "What do you mean?" He said, "No." He said, we don't rock the boat. We don't go against any narratives." He said, "Because we've got big pensions, we've got big futures ahead of us. We've only got a few years to do, and then we get out, and then he said our mortgages are paid off, and we've got a very nice life. Thank you very much." He said, "No, we're not going to rock the boat." And I said, "But some things are it's morally a problem. I mean, we're talking about ethical issues." But no, they're not interested in that because they're only interested in themselves and what they can get out of their particular position.
Yeah, parallels with the medical profession. I've worked in it for 17 years. I know there's ego. I know there's narcissism. I know there's bullying culture that's
Yeah.
rampant in the NHS, but also this whole what I call me, myself, and I mentality. So people only can care about if it affects them, then they'll start kicking off. But if it doesn't, and they can get to their pension and they can clear their mortgage, that was the original reason where people would tap me on the shoulder all the time and say, "Fair play, Dave, you're doing really well. Great, balls of steel. Great, you're championing medical ethics," privately and in DMs. And when you come to question them, why aren't you joining me in this war? There's pension, pension, pension. That suddenly moved then to, well, we've seen what they're doing to all the doctors that have spoken out. Now, I hear cases of doctors that are telling patients privately but refuse to document. "Oh, well, yeah, of course, this was the vaccine. Of course, what else could it be? You had the jab yesterday. Can you document that for me, doctor?" "Oh, no, I can't. I'll get sacked or I'll get struck off." Now, when you've got a profession so fearful of that, then you're never going to capture the adverse events for starters. I mean, most doctors don't know what the yellow card is, let alone examine the data on the adverse effects because they're scared to put it in ink on paper. And they're actually doctors not all the time coming into my room, checking that no one spotted them coming into the heathen's room. And they'll sit down and they'll say, "We're having all these vaccine injuries. How are you treating them, Dave?" I thought, seriously, but locking the door so no one can see this conversation off record, like. Help me make it make sense because I don't know at the moment. I wake up each day thinking that this has been some elaborate prank and somebody's going to jump out of a bush and say, "You've been framed."
Well, I'm always hopeful that eventually some things will break, and I think the more we talk about it, the more we push it out there, and the more eyes are being opened. Gradually, I think people are realizing, and I think also because a lot of people are sick right now. And I think that correlates as well with the amount of time that even Doris Carhill said, it could take about 5 years or so before people start to get really sick. And I
Oh
think
yeah,
it's actually
it's a multifaceted level illness. So again, when you've got a medical profession that don't even acknowledge it as a thing, and they're always looking the other way. If you're looking over there, you don't see what's going on over there. So if they're gaslighting and telling these vaccine injured people they're mentally unwell, and that's 90% of them get told the same thing. You've got functional neurological disorder. Your blood tests are all normal and your basic tests are normal, so it must all be up in the head. And then when you've got that issue, you've got no one actively researching what it is. So when you turn your body into a spike protein factory, what are the biological consequences of that? And as you mentioned, some of them are immediate, death, amputation, blood clots, heart attacks, strokes. Some of them are a bit more medium term. And then you've got the tumours, the cancers and stuff. And again, at that point, 4 or 5 years on, you can't pin the correlation causation argument. You can't. I mean, I've got doctors in the Cornish area that said the day after a vaccine, a stroke that happened on a young person, the day after was long COVID that caused a stroke, not the vaccine that she had yesterday. This is the cognitive dissonance and insanity, to be honest. That may even be some of the pathophysiology at play, because I'm watching my colleagues get aggressive and emotionally flattened and can't critically think. So again, the main problems when you're vaccinated are that you get your immune system damage, and that's everything from suppression of fighting infection to recognition of aberrant cancer cells. You've got blood clots, microclots, macroclots, PEs, and DVTs, and microclots to the brain, just firing off mini subclinical strokes, changing people subtly with each one. Then you've got the inflammation and autoimmunity of a human cell making a non-human protein. What's going to happen? The body's going to attack it. That's what the immune system does. So, and this widely biodistributed mRNA-induced spike protein is being attacked in tissues. And finally, protein deposition. So various people call it prion disease. Some people call it amyloidosis. I just call it protein deposition disorder. This protein, the body's never come across it, so hence doesn't know how to excrete it, so it embeds in tissues. And we were seeing work from Arne Burkhardt before he passed away, doing post-mortem, showing that the brains and the hearts and the testes of these young men that had died suddenly were illuminating with immunohistochemistry stained spike protein. It was embedding in the tissues, really distorting the architecture of the histology. And I'm sat there watching this, and then I would flick on the BBC and I'm getting told it's safe in children. Oh, what? And I get angry about that, and I'm in trouble because I'm harassing, or I've used the wrong tone, or I've been aggressive. But as far as I'm concerned, this is criminal manslaughter on a massive scale.
Well, I would agree. That's absolutely, and that's what we tried to instill in certain groups. I don't know. Mark Sexton's group also did a separate thing, with Ian Clayton and their side.
Cabinet somewhere gathering dust, isn't it? That's the problem. They're just
Well, yeah, but I kind of suspected it would, to be honest. I mean, I was quite open and honest with them at the outset when I said, I don't think this is going to go anywhere because this has already been taken care of. They know how they're going to respond. This it's not an accident that you can go to police stations all around the country and get the same response. So
sinister, isn't it? So sinister. It's been in lockstep from country to country worldwide. All the same response, all the same censorship, all in lockstep. The persecution of doctors. You can go to any country and you'll pick out 10 Dave Cartlands, in Australia, New Zealand, Canada, UK, and they're doing it, and they're doing that playbook of let's make an example of him, because that's what I get told now. The reason I don't speak out is because we've seen what they've done to you, and it's a beautiful tactic, really, isn't it? If you can get people absolutely petrified to even write down vaccine injury, let alone speak out publicly, because you get Dave Cartland did. And
that's why I can only suspect that all of this was planned well in advance, to include also putting out placebo injections to get people to advocate for it and say, no, that I had mine and it's absolutely fine.
Beautiful crime, beautiful crime. And there were placebos. I've seen lab analyses of people doing analysis of bios, and there were saline in the circulating vials that were going out. I've seen some horrifying things in some of the other vials, and there didn't seem to be any quality control because some had high concentrations of mRNA, some had low concentration, and you could pick 2 vials from the same batch and they'd have vastly different content. So you don't really want everyone dropping dead in the car park, do you? It might raise suspicions.
Well, exactly. And so again, that's got to be deliberate, because you wouldn't do that. There's no manufacturing process that normally allows you to do that sort of thing. It has to be quality control right way through.
Apart from Pfizer, who got their special batch, wink, wink.
Yeah.
You know what I mean? They're just looking after their own.
And their unblinded trials. Yeah.
None of it makes sense. I mean, I look at it, I try and think, they got something right. Let me think of what that could be. And I still to this day can't think of a single thing. This thing was manhandled. It was proper pee up in a brewery kind of stuff, really. And no one can, everything from, well, everything there's such a long list. All the silly rules, all of the money changing hands. Remember when they were paying people to stay at home, weren't they? What was that called? The
Oh,
scheme,
furlough.
furlough
Yeah.
scheme. And then after we were locked down, they were paying us to go out for half of our meal. They were paying half the bill. I remember that. You could order a massive Chinese, and the government would pay half of it.
Yeah.
Just what was going on?
Yeah, well, we're paying for it again now.
No, just bankrupting the country. And this is all when you step back. What is the scheme here? And then I can't come to any other conclusion that this was highly planned, as you said, highly coordinated in lockstep. For me, it's a depopulation agenda, and that sounds crazy, I know, but I can't think of any other explanation. They openly say there's too many people, and that, as far as I'm concerned, is what it is. I've seen no evidence to the contrary, and I'm just shocked at where are the oncologists, where are the coppers? I mean, when I spoke to the policeman, I have off record conversations to say, oh yeah, going to loads of deaths in the home suddenly. Paramedics that I come across, yeah, loads of people collapsing in the street, blue light calls that we've never had before. When you see that with the spike with the first rollout, spike in 999 calls with the rollout of the vaccine, almost identical, a bit like the midazolam. But we're going down rabbit holes now, so.
Well, that's all right. I don't mind. We have to shine a light down these holes sometimes and see what's there. But no, I mean, going back to when I was a policeman, and so that was back in the 80s. I mean, we were a different breed. I think we were a bit bolshy, and if we saw something that didn't look right, no matter where it came from, and especially internally, we'd be shouting about it and pushing back.
Yeah.
And if someone senior said something we didn't like, we'd tell them so. But that changed over the years, and I don't recognise these organisations now. They're not the same people that I used to work with, and I think they are just yes men. I think they're hired specifically to be compliant.
Yeah.
Then they're not as strong, I suppose, in character. It's a different world.
But again, that comes down to recruitment, doesn't it? Recruitment policy.
Yeah. But
characters
you
they're
see
letting
the
in.
people they are recruiting. I mean, if they're recruiting people with criminal records, for God's sake, so I mean, then that's been found out recently. I mean, it's just nuts. So, and of course, they're going to toe the line because they don't want to be found out.
Well, it's the same with doctors. They're actively selected for their ability to follow orders. I mean, to get into medical school, you have to present exemplary CVs for both curricular and extracurricular activities. So your whole life is geared towards, high achieving, following the orders, towing the line. And so you're actively recruited into medicine. Whereas my first degree was in science, and the ethos was question everything, critically appraise, look at the funding streams, conflict of interest. Does the paper's conclusion actually match the methodology and the results? Often it doesn't. Then you find out Bill and Melinda Gates have sponsored it, and you think, there we go. But then this degree is follow the rules. You do lectures, and this is this condition, and that's that condition, and that's the treatment for that, and that's the treatment for that. If that doesn't work, try this. And so you just algorithmic learning, and you've got these egos and narcissists and closet bullies given all this power with a stethoscope. I've seen it all my career. For the caring profession, they are most uncaring when it comes to looking after one of their own. I can tell you on 0 fingers how many doctors have stepped forward in my hour of need since I've been struck off. Zilch.
Well, everything seems to be lost. What we used to call the old bedside manner doesn't seem to be there anymore. And this whole idea of trying to assess an illness by basically using the computer, because you're just flicking from one screen to another. Have you got this? Have you got this? Have you got this? Oh, computer says you've got this, so I'd have this pill. Which is the latest.
There's a bleak future for general practice and A&E doctors, really, because it is becoming AI driven now. Like you say, even to access a doctor, to physically see one, you have to sell your soul to the devil himself, really, in terms of you've got to go through this process of click, 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 click. And often you won't see a doctor, you'll see a noctor, anyone but a doctor. And when you do see a doctor, it's like a lottery win. And even then they're Googling and using AI now. People are using it.
It's a shame. It really is a shame. Our GP, when I was a kid, our GP knew the entire family personally. you bumped into her in the street, and they'd say, "Oh, how's your uncle so and so? How's your sister?" Knew everybody. Even when my kids were younger, it was still like that, like 30 years ago. But now, if my doctor passed me in the street, wouldn't have a clue who I was. Not a clue.
And it's the reason I became a GP out of all the professions, specialities. I thought I remembered that old school GP from my childhood. I can remember his face and name actually, and he looked after us from it's that whole cradle to grave mentality. And I mean, I started my GP career, and it was just getting a bit. I mean, they were just cramming as many patients in. It was like a conveyor belt. You almost the patient would come in and say, "Oh, I'm feeling suicidal," and you're like, "Oh, this is going to be 40 minutes. I'm going to have no lunch break today." And they get you into that mentality because it's like a conveyor belt of people, and you're jumping from gynecology to headaches to bad backs to depression all in the same hour, and yet there's no personal touch. But to become a GP, you have to demonstrate that personal touch. You have to demonstrate holistic care. You've got to demonstrate that you're looking at the condition from the biopsychosocial aspect. You've got to look at the root cause. So if they've got an outbreak of eczema, is it because there's some stress in their life? You need to have actively ruled that out. And that's got, as soon as you pass the exam, you're not in a position to practice how you've learned to practice. You become this robot and, getting pushed and pushed. And when you break or you make a mistake, it's your fault. Are you resilient enough, Dr. Carr? The amount of times I got to ask that in my life, when you've seen 40 patients a day and you've had a pot noodle for lunch, you've held your bladder all day, you make a mistake. Are you resilient enough for this role? Serious? And then meanwhile, your bosses have got half an hour appointments. They're doing like 5 appointments in the morning, 5 in the afternoon, and you're doing 40 and running ragged. So it's a profession that's become rancid now. If you paid me £1 million, I wouldn't go back to it.
No, I understand that. Yeah. I was the same about the police as well, actually, when I left very much for the similar reasons that you've decided to get. I mean, I could just see what was going on. I could see the rot then, and that was back in 1990 I left. Yeah, I never wanted to go back.
The copper I've been speaking to recently, he looks exhausted every time I see him. He's telling me he's got like 35 cases on and he's working day and night in his own time. He doesn't see his wife. And he said, "Look, we don't know how to manage these social media cases. We just not got the resources to do it." And it's just, I feel for them. Yeah. And we're all being run ragged. I know teachers are the same, police, doctors, vets, everyone's being told to do the work of 2 or 3 people. It's deliberate, because again, while the pandemic was allegedly going on, if you're keeping people exhausted and busy, then they're not able to go and read the Pfizer documents or any of the published research that came out very early on about myocarditis. You just haven't got the time, and then you're always angry and aggressive when Dave Cartland walks into the coffee room with a paper saying you all need to read this, and people say, "I don't want to listen to your conspiracy theories." It's actually no, it's a published journal about myocarditis in the Korean population. You'd get pushed. Don't listen to that rubbish. This is bizarre behaviour from a profession that is ironically healthcare. So they should care for your health.
Yeah. Well, look, I've kept you for an hour and 10 minutes so far. We better wrap up, otherwise we're going to get exhausted again. But I don't want to do that to you. Just quickly, so next steps for you. So you're looking for this judicial review, I think, for this DBS thing.
Well, it's all financially mediated, really. So there's 3 fights. There's the FA appeal, there's a DBS appeal, and there's the head of the snake, which is the judicial review. You're given 3 months, which have passed. They passed long ago. The point of the matter is that if they can apply a lifelong sanction, aka strike off, then there should be means to have a lifelong appeal. When you've got, I mean, the money. I didn't have the money at the time. That's a simple fact. Didn't have the money. Didn't have the energy. I was depressed, anxious. How am I going to face a judge at the High Court and go through all of this nonsense? And then, like I say, I've got to pick which one. So, I really, really miss my refereeing. So that one needs fighting. The DBS is so unjust, insane, overreach. It's just, I shouldn't be on that list. I've committed no crime, fact. And then the head of the snake is the more difficult one because you've got to get them to agree. And somebody somewhere's got to justify to me why the prosecution were allowed to dismiss all of my witnesses, for starters. We had loads of comparator cases like the rapist being let off, and as a doctor said he was going to come and kill me, slit my throat. The GMC said, "We're not investigating this case. It's not reached the threshold for investigation." A doctor, as I mentioned earlier, the doctor from Portsmouth said, "We're the GMC. We're a medical regulator. We don't regulate harassment, and if you think you're being harassed, go to the police. Meanwhile, I've been struck off for harassment. So somebody somewhere's got to justify these decisions. The FA's extreme ban, suspension, should I say, the DBS's ridiculous, unjust decision with no base to it, and then finally strike off for something that doesn't involve patience or negligence or any clinical matters whatsoever other than Twitter, he said, she said, and 5 letters that the GMC never received to be able to even judge on. So it's all hypotheticals, and I don't know how I'm in this position on the 19th of February 26.
And then, so what legal support do you have? Do you have any offer of support from any pro bono work going on or anything like that?
Well, this is the problem. So as soon as my name gets mentioned anywhere, people kind of like bottle it. I think it's just like people are seeing this oppressive assault on a man's life, and if they associate themselves in a legal matter. So I've had lots of offers of advice, I've had lots of offers of direction and support, but no one wants to really grasp the nettle and say we're going to overturn these. I mean, for me, they're easy wins, aren't they? I mean, the bloody FA to tell me I can't stop playing. You know, who are the DBS lists to put me on a criminals list when no crime's been committed? These are slam dunk easy wins. I just need some help and support. So yeah, it's going to be a case of funding, selling a kidney, whatever I've got to do to raise. So I don't even know what money you'd need to fight these 3 cases. I wouldn't even know the figure, let alone find legal counsel.
No, it's going to be substantial, I'd imagine.
I would imagine as well, and that's the thing. That's the big prohibition here. That you need thousands and thousands of quid for legal counsel to undo these things. It should never have happened in the first place. I've watched all my colleagues struck off one after the other who have spoke out. So no wonder doctors won't speak. And then the cost. I mean, they said you can appeal the decision. You had a month. They wanted 20 grand in advance. Plus, if you lose, you pay GMC's costs, which at the time I looked at was 6 grand per barrister. If you want a judicial review, you've got a 3-month window, but you're looking at 50 grand to start the ball rolling. Who's got that sort of money, particularly when they've just been banned from practicing medicine? No, and I can't even get a driving job at the minute because they Google me and see this horrendous amount of slander.
Then you can't even borrow because you can't pay the thing back, can you?
This is part of it. It's reputational damage and smearing, loss of role and hobbies, and financial ruin. It's part of the tactic. I can see it. Anyone can see it. Again, they know, the FA know, and the DBS know they've got not a leg to stand on if they're in front of a judge here, a fair judge. It's just insane. It's just completely you can't justify the decisions made. So somebody somewhere's head's going to roll. And somewhere along the line, I'm going to get compensated for the stress and the harm it's caused me. Like psychologically, it's made me ill. Like the last few weeks in particular, it's really made me ill. But yeah, if anyone's listening to this and can help or is a barrister, I mean, I said to people, if you work pro bono for me and I win a compensation, you can have the compensation. I don't even want it. I just want to right the wrongs here. I want to get back to doing my job, have my license back. I won't use it in the NHS. You've got my assurance. I'll never use it. I want to be part of that, but take me off the criminal list and allow me to referee bloody football for the minimum wage at the weekend. These are like basic human rights. So if anyone is listening and can help, please do. Or know somebody who can help because
we'll ask around because we did have some contact with some friendly barristers, but they've gone very quiet in the last couple of years.
Actually, see what I mean? You get this quietness and there's an initial interest. They dig into it and they back off. And particularly when my name's mentioned, I find it very odd. Because I've committed no crime. I've harmed no one. There's not been a criminal case here.
We'll still ask around. I know. So internally in UKMFA, we've been talking about what might be done regarding the GMC. So I think Sarah's working on some things. So I can't say too much at the moment, but we are going to be looking at some strategies, which I'm sure you'll be involved in, as will other doctors that have been in a similar situation. So
yeah,
we'll see what we can do, and we'll keep fighting, keep pushing, and yeah, don't get too down, mate. We're here, and we won't let you sink.
Thank you. Yeah, and thanks for the chat as well. It's been good, like I say, and just want to raise awareness. Really, that's my end goal at the moment. I figured my only power at the moment when I'm at rock bottom is that firstly, there's only one way to go. That's up.
Absolutely.
And the second thing is, one of the things I hate about me is my reach, the followers I've got, and the fact that my reputation's growing rather than shrinking. By them doing these awful things, it's just bringing more sympathy to me and attention to my case. So yeah, anyone who wants to interview, I'm happy to do the conversation, and let's call this out, because like I said at the very beginning, if it's happened to me, it can happen to you. anytime in this totalitarian dystopia that we're heading for.
Well, good man.
All right.
Look after yourself, and yeah, we're here. If you ever want to chat, well, you got my number now. I'll send it to you, so no problem. All right.
Cheers, Ian. Thank you for your time.
All right. Take care. Cheers.